This video is for the medicine residents. Yesterday, there was a case of acute kidney injury. While receiving the dialysis, the blood pressure of the patient went to 200. The residents were having doubt. Sir, as you told in the video or during the rounds, a CKD patient is more prone to develop this kind of high blood pressure owing to the volume overload. Yesterday, the patient who developed hypertension was not in volume overload and it was a case of AKI, acute kidney injury. The topic hypertension during dialysis. We already discussed with related to the CKD patient. High BP is common during AKI also, acute kidney injury also. The reason volume related might not be there. Sometimes because of the endothelin RAS system, sympathetic system activation. Why this activates? Because the blood is going through the extracorporeal circuit where the membranes are there, synthetic cellulose or whatever the membrane may be. The blood is coming in contact with this and getting back to the patient. During this time, in the body, any system, sympathetic system, RAS, endothelin, these kind of activation can occur, because of which the patient can develop high blood pressure, which can go as high as 180 systolic, even 180, even 200, which are in the hypertensive emergency range, and that further decreases the kidney function, or overall it have an impact on almost all the organs of the body. So this is hypertension during dialysis, which in turn causing more injury to the kidney. How to take care of this? In the first dialysis, if the patient BP shoots up, there is a high chance in the subsequent dialysis the patient BP might go high. So adequate antihypertensive medication have to be given. The BP have to be titrated to keep the patient BP towards 140 or below that. The medication have to be given adequately. Suppose during the dialysis itself the BP is going high, a continuous rapid acting medication might be required, like infusion of any antihypertensive medication including NTG or labetalol. So we have to bring the BP down because a patient need clearance. Because of the high blood pressure, we can't stop the dialysis. Make sure the patient is not receiving any antihypertensive medication which is being removed during dialysis. A high flux dialyzer, if it is used, a patient have taken the medication that will be washed away, that might have caused rebound hypertension. In some texts, you might find this as paradoxical hypertension. Why paradoxical? Because in dialysis, mostly we might be removing volume. So a patient is having blood, volume is removed. So what should happen? BP should come down. In most cases, it do so. But in some cases, up to 15 to 20%, BP might go high. Ruling out the most common volume part, in AKI, this system activation, sympathetic RAS, endothelin, sometimes patient reaction itself can be, you can't explain why this is happening. A patient might be individual or prone to this reaction, or might not be tolerating the dialyzer membrane. Making sure that the dialyzer has been washed adequately to remove any sterilians which are present inside. So for the medicine resident who had the doubt yesterday, this is why the patient BP went high. Tomorrow BP is bound to increase, so we already adequately dosed the patient with the antihypertensive medication so that dialysis will occur adequately. So this is pertaining to this particular patient. For MCQ, they might ask you what are all the drugs which are being removed by the dialyzer. For MCQ, you can go through the list of the drugs being removed during dialysis. Bye-bye.